Thank you so much for being here today. Welcome, welcome. This is our weekly speaker series, and what we get to do is hear from somebody who is in some kind of interesting career or owns a business or something like that. They're going to tell a little bit about their business or about their career path, their education, and how things went, and how life happens. You know, we make one plan and then things change sometimes. And then we'll have some time at the end for questions. All right, so today we have Hillary Berenbaum, and Hillary and I have known each other since we were 14, I think. Woo! Since we were about 14. So don't tell any secrets about me. But thank you so much for being here. Go ahead and get started.
Okay. Hi, guys. My name is Hillary, and thank you so much for taking the time to listen to me today. Your teacher, Mrs. Allen, asked me to speak about my career. So I am a registered nurse. I became a registered nurse in 1994. I always knew I wanted to be a nurse ever since I was real little. It was never a question for me. My career path. So I went to, I did my first 2 years at Philadelphia Community College, and it was so inexpensive that I was able to pay out of pocket for my courses. This is back when dinosaurs walked the earth, from 1990 to 1992. And then from 1992 to 1994, I went to Thomas Jefferson University, which is in Philadelphia, Pennsylvania. And I did my 2 years there. So 4 years of nursing school. So my prereqs were at Community, and my last 2 years were at Jefferson. There are many different ways you can go about getting your nursing degree. There are LPNs, licensed practical nurses, I think, but I am a registered nurse. I didn't want to have, I always wanted to be an RN. I think an LPN, there's limitations as to what you can do, and I just didn't want any limitations. It was never an option for me, never an option that I wanted, but it's not a wrong option for some people. Anyway, I'm talking too much. So anyway, graduated 1994, and I had my first job at the Hospital University of Pennsylvania, where I took care of orthopedic patients, which is bone surgery, and some trauma patients. So I worked there at the Hospital University of Pennsylvania. And then from the ortho trauma unit, I went to the surgical intensive care unit at Hospital University of Pennsylvania. Back then, it was a level 1 trauma center. So we got all the really sick patients. It was very interesting. I learned a lot. It was a great place to learn. After that, I went to risk management, and what risk management is that every hospital has lawyers working for them. I'm so sorry, I have a dog, guys. It's risk management is if there's any oopses in the hospital, if things went wrong.
You could show him.
He's really cute, everybody.
Oh, oh, so sweet.
He is. He's beautiful. So, for example, if someone opened the wrong leg, the wrong side of the head, fun things like that. So I did a few years of risk management, and I started having children. Now, the best thing about nursing is the flexibility. You see how many different types of nurses or different types of specialties I've done. So I had my first child, and then I took 8 months off. And then I went to the recovery room right after the operating room for a few years, very, very part-time. This way I was able to be with my newborn and still be able to work. After that, I did a substitute school nurse for a few years. I worked at the camp as the camp nurse. I then started the emergency room. Jacob left. He didn't like me. I went to the emergency room for a few years, which I absolutely loved. It was fascinating. I truly, truly enjoyed my time. I was a nursing supervisor for one of the local hospitals, and now today I infuse chemotherapy. I work with mostly oncology patients. It's an outpatient practice, which means it's not in the hospital. Patients come from home to receive their chemotherapy. Um, so what else? So that's where I am today. If you see, I have some initials after my name. So where I went to college in undergrad, they like a lot of initials after your name. And Jefferson said, everyone get your masters, everyone get your masters. So they kind of brainwashed you, which is a good thing. And back in 1996, I went back to graduate school and I got my MBA. I did not know what to get my master's in. You can become a nurse practitioner. You can get your master's in nursing and teach nursing courses. There's nursing information technology courses you could take. Nursing is so vast, which is great. I did not want to be a nurse practitioner or get my master's of science in nursing. I wanted it to be a little bit different. The first boss I had in my nursing career was not the nicest person and was very intimidating. And when I found out about the MBA in healthcare administration, I said, that's what I want, because one day if I become a manager, I will not do that to my staff. I will be nice and accommodating and have an open door. So I only used that degree a little bit. Guys, there's never such thing as too much education. You can always hold a degree in your pocket and use it later on, which I haven't used it really that much because I've had 2 other children, so I have 3 children. And maybe one day I'll go back to management. I don't know. But right now I infuse chemo. I'm very happy. I work Monday through Friday, 8:30 to 4:30. Now, if you work in a hospital, you can work, depends on where you work. You could do 3 12-hour shifts, which is full-time, which is nice because one day if you guys decide to have children, or if you like some days off during the week, you could just work 3 days. 12-hour shifts are very tiring, but they're not too bad when you're young. I'm old, just like Mrs. Allen, so it's a little hard. I did say that. You could do night shift. Night shift makes more money. There's a weekend program in some hospitals, which makes the most money. What else? It's just a great profession. I have no regrets at all. I'm always learning. That's one thing. You never get too comfortable where you are. There's always something new, whether it's a new medication, a new protocol. Every day I'm learning something new. I've been a nurse for 25 years, and every day I'm learning. Now, I've only been in oncology, it'll be 2 years in August, so I'm fairly new to oncology. I have a lot of flashcards. I have some study guides at home, some questions I can answer, so I can teach myself a little bit more because I don't have the vast knowledge that I had in the emergency room. But even in the emergency room, I still always ask questions. There's no such thing as a stupid question. You only look stupid if you don't ask the questions because you don't want to hurt a patient. It's the worst thing. Never hurt the patient. Do no harm.
That sounds great, Hel.
Yes.
Thank you so much. Well, we have some questions from our students now. I'm going to ask you. You don't even have to pay attention to the chat at all. I'll monitor the chat, and I'll tell you their questions. So, let's see. First of all, before we even start, will you tell us what happened this week? Sounded like a big deal. I heard you did compressions for quite a while. I don't know how much you're allowed to share and what you're not allowed to share.
So no, I will not violate HIPAA. It was a patient getting intravenous into your vein chemotherapy, and reactions happen. And I by this patient, giving them emotional support during the reaction. We were trying to fix it with other medications, and we lost pulse. So I just started doing compressions. Didn't think about it because coming from the ER, you get codes all the time. And thank goodness,
Right.
the back and he regained his pulse. Yeah, you saw the picture of me on Facebook, huh?
You're so cool. 4 minutes is a long time, huh, to be doing that.
I didn't even think about it. I did it with 2 masks on, but you don't think about it because then when I was done, I'm like, damn, I'm hot. They're like, you just did that with 2 masks on. I'm like, why?
I am so proud of you. You're gonna make me
Um,
teary-eyed. I'm getting all belly. I'm so proud of you. And so the question here is, what is your favorite thing about your career?
My favorite thing.
Or a favorite thing, yeah.
I do enjoy the flexibility. Let's say I get tired of oncology, I can then go to another specialty. I can go back to the ER. I can go to a surgical unit at a hospital. I can work or it's not like you're stuck in one position for your entire career. Move on. So that's one of the numerous things that I enjoy about my career.
And do you have to renew your license? Like I have to renew mine every 5 years, I think. I pay a fee to the state.
Yes, so we pay a fee as well, and we have to renew it every 2 years. And you have to show that you have 30 continuing education credits for those 2 years. And it sounds like a lot, but it's really not. You can do it a little bit at a time, or there's books that you can get and then just do it pretty quickly. It's just to make sure that you keep your knowledge base going. So every
Right.
2 years, pay money to the state and then give you a new piece of paper, and then you're good for 2 more years.
Do you think you would change your job to a different specialty in the future? What other specialties might you want to try in the future even?
If I were to ever leave where I am now, it would either be back to the emergency room, because you never know what you're going to get. I sound like Forrest Gump. Or I would just go into management. I don't know if I'd make a lateral move or not. It all depends.
Right. And why did you choose nursing even when you were little? Like what made you interested in that? Do you remember? Was it
Yeah.
one specific event that triggered it?
Well, so my mom was diagnosed with a form of arthritis when I was 9, 7, 9. I don't remember. So I watched her go through numerous surgeries.
I remember.
So, seeing that, I was always fascinated with what the nurses did at the bedside. Whenever there was an ambulance, and since Mrs. Allen and I grew up in Philly, there were tons of ambulances. And I always want to know where they were going, what they were doing, what the ER. So that's just something there wasn't one thing, but it was just those two in particular.
Here's a good question. Were you ever scared of messing up?
Every single day. That's why.
I feel the same way as a high school teacher.
See, guys, you think adults know it all. We don't. Right. We are kids in adult body.
Thank God I can't mess them up too bad now. They already know how to read and everything.
Well, see, that's perfect.
Yeah.
Yes. There's always that fear in the back of your mind. You don't want to practice nursing with a fear all the time. As a new nurse, a lot of things were scary, but you kind of put on your poker face. When I first started this job, I was petrified. I didn't know any of these medications. I felt like a brand new nurse. But, you prepare yourself, you try and read some stuff at home, and just the more you do it, the easier it becomes.
Okay, here's another question. What do you think are some values that would be considered important when it comes to working in oncology specifically?
Values.
Like what would be, like as a character trait, is there anything that would be important? Like if you were hiring a new nurse, what would you look for?
Well, you really need to be a team player as a nurse. You know, they're not just your patients. You work with nursing assistants or technicians. Everyone calls them something different. You know, the doctor's involved. You really want to be a team player. You don't want to sit there and you see someone running around with a chicken, like a chicken with their head cut off. You need to help people because in return, you're going to want the help. I would also, especially for oncology, these patients are very scared, they're very sick, and they like to laugh. They don't want gloom and doom. And me and my colleagues are extremely fun. We are a little immature at times. We make the patients laugh.
You, immature?
Never, never. What am I saying? Um, one patient, for example, is into sports, used to coach sports, and we were talking about planking, and she told me about this one plank that she taught her students with a wide plank. So I said, I want to do it. So I got on the ground and I planked right in the middle of the treatment room, and she timed me.
I'm thinking back to our senior year. We spent graduation night. We had a sleepover, and then
I don't remember this.
prom. Oh, I know where we spent graduation night. I remember that. I'll tell
You
you
do?
later.
Well, we're gonna have to discuss this later. I don't remember a thing.
And then senior week, we went down the shore, right? Remember Wildwood?
Yeah, not really, but I stole a pair of me I told her about.
Remember, oh my God. Well, anyway, we'll tell that later. So they're mostly all seniors and they don't get a graduation. And your daughter's a senior this year too. Are you guys
Yeah.
having a graduation?
So guys, look, I know that this is hard. Like Mrs. Allen said, I have a daughter who's a senior. And I did tell her in the beginning of March, I just assumed, I said, Jenna, because that's her name. I said, you are not going to have prom, you're not going to have graduation, and you're not going to have senior week. This is before everything was called off because he kind of saw it coming. So she cried. She was a little upset, but now she understands. Now, I know this is hard. Let me be honest with you. There's going to be a lot of great things to look forward to in life. I do not remember my proms or my high school graduation or my college graduation. I think I have. But anyway, I promise you that this shall pass and you're going to have so many amazing things to look forward to.
Yeah, that's the truth.
Yeah.
Do you want to tell us maybe not a gross story, but maybe some cool story, like nothing too vomity or bloody, please?
Well, you said please. So, okay. There's a reason why I couldn't eat strawberry cottage cheese for a while. So, a patient fell, I don't remember if it was 30 feet on their head, and part of their brain contents were coming out of one of their ears. So, they eventually died, but it looked like strawberry, raspberry cottage cheese. So I had to suction it out with a suction catheter because my patients always had to be neat and clean, and I didn't want brains coming out and messing up the bed. Was that bad?
Oh!
You didn't feel it?
Nobody eats strawberry cottage cheese here anyway.
Oh.
But that's really, yes, that was gross.
I don't know, patients like in the ER, if it was, we get snow here in Philadelphia, people. Well, I'm suburbs of Philly, but anyway, if it was a snowstorm, people would use their snow blower and then they would use their hands to try and make the blades move again, and a finger would fall off. So then they would come into the ER with a finger in a Ziploc.
Oh my. Wow.
They look rather pale when their fingers are in a Ziploc.
Yeah. One more question here. Hey, Sean, you could turn your video off. Do you take care of patients after surgery?
When I was in the hospital, yes. Back on ortho trauma, yes. In the recovery room, I recovered them before they went to the floor, which means made sure they were breathing enough and awake enough and safe enough to go to the floors to be treated then. And then in the surgical intensive care unit, yes, they would come to us after surgery. And, at Penn, they would do surgeries that other doctors wouldn't do. So these patients were particularly ill. That's why it was so fascinating. They would actually do surgical procedures at the bedside because they didn't want to move the patients because they were that ill.
How do you handle looking at bloody or these things that you see sometimes?
You know, there's going to be that one thing that will gross you out. Everyone has different things that gross them out. Some people don't like throw up. Some people don't like poop. Some people don't like, I don't know. You kind of have to handle blood for this. You have to be able to see it and not get grossed out a little bit. But like I said, the more you do, the more you get used to. I can't do eyeballs, guys. My sister-in-law works in an eyeball place, and she asked if I wanted to work there to recover them from surgery, and I said, absolutely not. Eyes gross me out.
That's the one thing you can't.
I can't. I just can't. No.
I think I took some of my husband's stitches out a couple times for him. That was pretty cool.
And see?
Yeah, and I really like pimple popping, but that's really my limit.
I love that show.
She's only about 20 minutes from us.
Oh my gosh.
So if we're ever allowed to fly again, you can come out. Yes.
Yeah.
Well, thank you so much. That was exquisite and such a joy and so wonderful to hear about your life and connect. I miss you.
I miss you, Kim. I love you.
I love you, Hill. All right, I'm going to have you log off and stop everything. Thank
Bye,
you, guys.
Susan.
Good job, Miss Berenbaum.